The rotator cuff is a group of 4 muscles that surround the head of the humerus and help keep it securely positioned in the shoulder socket, called the glenoid. These muscles work together to stabilize the shoulder and allow you to lift and rotate your arm. Initially prepare the rotator cuff and the humerus bone by creating a medial bone socket to accommodate the first guy roll-lock anchor using tap. The 4.75 mm guy roll-lock anchor is preloaded with a ready-to-use suture tape, streamlining the surgical process. Place the guy roll-lock anchor into the prepared bone socket and release the suture tape. A suture retriever is then used to position the suture tape for the subsequent step. With the Scorpion suture passer, pass the suture tape through the rotator cuff tissue and retrieve it. A suture retriever is used to create space for the insertion of a second anchor. This process is then repeated for the placement of the second 4.75 mm guy roll-lock anchor. Retrieve one suture tape tail from each anchor and load them into a new 4.75 mm guy roll-lock anchor. Following preparation of the lateral bone socket, insert the preloaded 4.75 mm guy roll-lock anchor. Trim the excess suture tape. The remaining 2 suture tape tails are preloaded into the final 4.75 mm guy roll-lock anchor, which is then inserted into the bone. This completes the rotator cuff repair using the double row technique.
Auxein.